Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine Show. Hope you're all doing fantastic. I have a special guest tonight, or morning, wherever you're at. We're going to be talking about testosterone. Does testosterone really work? A lot of people have a lot of questions about it. I have Dr. Jody Tanner here. You can also find her at livingwelldakota.com. I take it she lives in Dakota. I'm just playing. livingwelldakota.com. So you can also reach her at 701-712-8555. And again, thank you so much, Doctor, for being here on the show with us.
Thanks for having me. I appreciate the interview.
Oh, I'm excited because we have I call it, I don't like to use the word touchy subject, but we have a subject that I see a lot of people on the internet talk about, testosterone, especially in the men field. You know, a lot of men use it for working out, you know, a lot of men in their 40s and 50s. And I see that it works, but I also see a lot of people having questions about it. But before we go into testosterone, if you wouldn't mind maybe just telling us a little bit about yourself and how you began livingwelldakota.com.
So basically, I just decided that I wanted to go out on my own because I wanted to be able to have the freedom to create and use my own ideas to help people find healing. And I wanted to get back to the grassroots of health where your voice is heard and you're able to, we bring the doctor to you, meaning that we're able to have access to the doctor. I think we have gone away from actually allowing, even we call them patients, but I call them clients because patient is even some of the words that come along with patients. If you look it up, it's like victim, sufferer. And I don't like that. That's not empowering. I don't think the word patient is empowering. I think I see you as a client. I see you as somebody who we are collaborative together to help you become the CEO of your own health. And to find access to me and to be able to have access to me, I think we have created a system in medicine where we have so many steps to get to the doctor that it disempowers the client to change and to find wellness. And so being able to take those ideas and use that creativity on my own, I decided that, hey, I gotta make the break.
I love how you explain that. You know, back in the 50s, it was more like that. Mm-hmm. And I love that we bring the doctor to you. Yours is the first website I've ever actually seen that approach. And I like that because you're going back to the basics. You're going back to where it all began. It's people. It's helping people. And I'm not saying about your practice, but I've noticed that a lot of doctors out there, you know, you're just continually coming back getting more pills or getting more whatever you need to get just to get you through. And the type of doctor that I've noticed that you are is you want to find the root. Okay, let's find the root of the situation and let's get you better. And that's what we need. America needs to get back to. You know, I love that. So tell me a little bit about, you know, how long have you been in practice and what not just how long have you been in practice, but what got you into helping people with testosterone? We'll take it from there.
So I think it's my own personal journey. I worked in, for the VA system, kind of internal medicine type of thing for several years, about 14 years. And I felt like I was just kind of pushing a lot of medications. I knew what medications did this and what side effects caused this. And I felt like the perspective was, when you come in the door, what kind of medication that can we put a Band-Aid on the problem and get you to feel sort of better and I didn't feel like that was working, especially when I got sick myself. It didn't work, and that traditional side of thinking didn't work for me. And that's why I went on my journey of saying, okay, what is out there? How can we really get to the root cause of what makes us sick? And I think there's a lot of truths out there that we aren't collaborating together. I think the naturopathics, the chiropractics, the allopathic, we all have a perspective that needs to join in unity and to be able to use their skills and to bring those together to find wellness. And so that was my main concept, is I wanted to go on this search of why are we ill? And so that's when I started my journey of just learning, reading, studying, going to conferences. And I eventually became functionally medicine certified because I felt like they had some concepts that they could bring to the table. And then, there's a lot of things about cleaning up my gut, cleaning up my diet that I had to look at. But then I knew that there was a missing piece, and that was the hormone piece. And that, especially when I went through menopause, I realized, hey, there is an element that I was missing with the hormones. And there's something we know some things about hormones we do know, but there's some reason that we are just being attacked hormonally. And with those hormones aren't balanced, we're never going to find that wellness we're searching for. And so that's kind of what got me in the path of learning about hormones. Is basically I couldn't sleep, and I felt achy. I couldn't think well. And I was just like, hey, if this is what menopause is about, who wants to go till 85? This isn't fun. And so I just was kind of searching for that. And, I came from the era in my profession where the WHI studies to take everybody off hormones, and I think that was around 2001. And we did that because they thought that it might cause, some cardiovascular risks and breast cancer, but we didn't realize that it was the non-bioidentical hormones that were the risks that were involved. The bioidentical hormones is exactly the chemical structure of what's in our body. And so I was like, gosh, we've not allowed women to have hormones for 21 years, and we scared them away from something that's made from a yam that can make us feel fabulous. And so that's when I went on this search and started to do bioidentical hormone replacement. And it was amazing. I felt like my brain got a new pair of glasses. I finally realized, hey, this is what's having a libido about. Women need testosterone. It's not fair that you can't have the libido either. And so to realize that's really important, not only testosterone to our brain function, but also to our bone strength. And also to our cognitive function. And, and there's also that benefit of it increases our libido, and it increases our ability to connect. If we don't have hormones, we have this irritability and an inability to connect because, we just don't feel well. And that's what I felt hormones did for me, is I felt like, hey, there's a new look on life. And my brain can now function, and it's just amazing. It just really lights people's lives up when you balance.
Did you notice a difference right away when you started to try it?
So yes, I noticed differences pretty quick afterwards. But this is what I tell all my clients: is I think there's several things into our health, and it's like a medical puzzle. If we if there's several pieces missing, and we just start for the first 2 or 3 pieces, we're not finished yet. Those 2 or 3 pieces is start of the puzzle, but until you get the full picture, we have to continue to connect the rest of the pieces. And so if it's just the last 2 missing pieces of your puzzle, you will notice a really quick response. But I think I would say 95% of the people notice some sort of response or even greater, especially if you've gone through menopause or you've gone through and you haven't had hormones for a period of time. But, not testosterone is not for everybody. I mean, you might have a thyroid issue. You might have
I see.
Hashimoto's that has to be cleared up. That's a hormone. You know, looking at insulin, insulin's a hormone. Cortisol's a hormone. Even leptin's a hormone. Vitamin D's a hormone. Progesterone's a hormone. Estradiol's a hormone. So there's a lot of different hormones that, and then women are more complicated because we have a few more in hormones in that mix. But you have to look at all of them. And but I would say, yes, I noticed an effect pretty quick. But also, if you don't clean up your gut and learn at other reasons that maybe are causing the low testosterone, some of the common reasons for low testosterone is sleep apnea. A lot of people, you know, I try to fix the testosterone, but if they don't fix the sleep apnea, it's very difficult for them to feel well because they're not resting well, because they're not breathing at night, you know, and so, you know, that's a common thing that we have to look at. And also there's something called chronic inflammatory response syndrome, which is something that affects the innate immunity. And what that does is it drives your testosterone into drives your testosterone into estrogen and lowers your testosterone.
Oh, wow.
So if you don't correct that innate immune response, you know, again, you're still not fixing the root cause. And testosterone is affected by estrogen. Sex hormone binding globulin, what binds up the testosterone, can be affected. You know, estrogens can affect that, as well as insulin, as well as thyroid can affect that. And so it, you know, there's several moving parts that we have to look at and address. And so as we do that, we begin to find that picture that makes you feel well.
I like that. So what I'm hearing you say is that it's looking at the whole body as a whole. You might think you need this, but hey, you might, before you get this, we need to fix this. There are certain steps that we need to take sometimes instead of just going, right, I need testosterone, because, correct me if I'm wrong, you know, before we do anything, we do a blood work, correct? How would that, how would that work? You would do blood work, and what would let's say if I was going to be a patient of yours, how would those steps look like?
So yeah, so I do blood work. There's different ways in which you can test hormones. There's a Dutch test that you can do, which is more of, you know, there's a urine test that you can check, there's saliva test, and there's blood testing. I do more blood testing. I think, you know, there's pros and cons to each form of testing. I think estrogen, you can see through some of the urine testing how estrogen is metabolized. Estrogen's a little bit, I think, better to do with a urine sample, but generally most people want just to get their blood drawn, and so we can see a sort of picture with that. Testosterone, I think, is better accurate to be tested with blood. And so that's where I start, is I do a blood panel, which is a complete blood panel where we check, you know, all those. We check the thyroid, we check the testosterone, the estrogen, the insulin. I like to check ferritin or iron can affect how our thyroid works. And so, you know, there's just a basic panel that we do with basic labs and go from there.
Awesome. Have you noticed since COVID, a lot of people coming in with brain fog? And if so, you were saying something about the brain, that it helps clear things up. Have you seen anything like that?
Yes, I think COVID is still, we're trying to work that out and trying to figure out what is causing this immune issue that's going on. I think balancing the hormones helps our immunity, but I also think there's other steps with, you know, long COVID that we have to address. And I think what long COVID has done, it has not allowed us, it has for so long, I think we can ignore our health. And now when we've gotten COVID, if we have some underlying condition, we can no longer ignore our diet. We can no longer ignore that pain that maybe we were trying to ignore. And it just brings all these medical problems to the forefront and just says, hey, look, you got to take care of yourself. And so I think, and looking and digging deep, I mean, hey, is your asthma controlled? Hey, is this controlled? Yeah, and your hormones is part of balancing that and getting your energy back. But I don't know of any association that COVID is causing low testosterone, other than there is some studies that I have seen that has shown that this inability, or if you have this genetic halotype that you can't present your innate immunity to your adaptive immunity, it can take your testosterone and aromatize it to estrogen. And you can have low testosterone. And if you don't correct that chronic inflammatory response syndrome, which some people think is aggravated by COVID, it can literally cause kind of this increasing storm of health problems. So I wish it was just a simple answer, where you can just, I wish I could just give you a pill.
You're like, yeah.
And I tried that and it didn't work for a lot of my clients. It just doesn't work. And there are sometimes that medications are needed, but yeah, so that's kind of what I felt with COVID is, it is a piece to it, but is it the whole piece? No.
Awesome. So my question to you, with the amount of people that you see, say, working with testosterone, would you say that it's 50-50 with women and men? Or what would you say the number that you're averaging seeing?
No, mostly women. Mostly
Really?
women. I would say 70% of women for me.
Wow. Huh.
And I think there's a lot of, most women go to the doctor, men don't.
You're right about that.
And I think you see that even in a clinic, in a normal clinic, you'll see mostly women. Very few men come to the doctor, and there has to be a lot of things that motivate them, especially if their testosterone is low and they're having some dysfunction sexually. It's not something you want to necessarily go address with your provider. But it's just amazing. It's like, it's amazing if you do take care of that, how much energy, how much better sleep you're going to get, and how quality of your life is just going to go up. And a sign of our sexual health is a sign of our health. And so if we're not functioning sexually, then there's something wrong.
Wow.
And so we need to make sure we fix that. And it could, again, if we're not functioning sexually, it can also mean cardiovascular disease, because we have nerves and a vascular system, and we have a hormonal system that keeps us all functioning sexually. And so, we got to make sure that we address that. So if that's not working in your life, you need to realize something's wrong. And let's not wait until you have a massive heart attack to figure it out, but it's a sign that you're not doing well.
Wow. It's interesting that you said that you see mostly women, and it's awesome because I'm able to connect with other doctors, and some doctors out here, 95% is men. And what I'm seeing is that a lot of men are taking testosterone from ages, say 40 to on up. It's because they feel maybe more sluggish. They don't have the energy to go work out. And I also, correct me if I'm wrong, but I also heard that it helps when you're working out to build on muscle a lot faster.
Yes, for sure. It helps you lose weight because you're building more muscle than fat. And so, yeah, most definitely.
How does it help with the bone density though? That doesn't really make sense to me.
There's some studies that it actually improves bone density, and I can't tell you the exact scientific mechanism of how it works with the osteoclast and osteoblast, but there is some research and studies that show it can help with bone strength, because a lot of times you can't give estrogen in people who have breast cancer, but you can give testosterone, and it can actually improve the bone density. And there are studies that shown that it does improve the DEXA scan.
Yeah, I believe it. I have some friends that are like in their 60s, and one of my friends is like, yeah, I only work out, 2-3 days a week. And I'm like, dude, you're buff. Like literally chiseled out. I'm like, the guy's like 65. I'm like, wow, maybe I need to go that direction. But
now I don't think I look buff like that,
no,
but
I mean,
work with that. I don't put that in and you go out and look like Arnold or something.
Oh boy, I love it.
Yeah.
So let's go a little bit deeper here. Or would you say all testosterones are equal?
No, there's non-bioidentical testosterone and there's bioidentical testosterone. And the non-bioidentical testosterone is more likely to cause platelet stickiness. So when you have platelets that stick, it's more of a clotting type. So you're more risk of cardiovascular strokes, high blood pressure. There's just more risk with the non-bioidentical testosterones.
When you say platelets, we're talking to, we have people out there that maybe are wondering, well, what did she just say? Platelets that stick. How would you break that down? Pretend I'm a third grader.
It's like clotting. It's like when you bleed and things kind of clot, those platelets help in kind of forming a clot so that you don't bleed to death. And so, you don't want to have a lot of platelet stickiness because you don't, want to have the risk, like cardiovascular risk that comes with that. And so there's definitely more links to the non-bioidentical hormones.
Wow. So as we talked about them not being all equal, what are some of the things that people should be asking? Because I mean, there's people that see they might possibly need testosterone, but they see, okay, this doctor over here, or they're seeing it online, is selling it for $59.95 a month. Just take a pill and it'll help you boost your immunity and everything, compared to say paying 4 or 5 times more than that.
Well, testosterone should be given as effectively orally, because it can go and break down in the liver, and there's disadvantages for that, more gallstones, blood pressure issues and stuff like that. And I don't feel like it's as effective as doing it in the best way of doing testosterone is to do it either through, you have to do it in injections. There's some non-bioidentical that you can do through injections. And also you can do it through a cream or subdermal route, or you can do it through a pellet route. And a pellet is where we actually insert it into the subcutaneous fat of your hip.
Wow.
And then the blood vessel forms around that pellet. And every time your heart beats, it gives you continuous testosterone. I felt the way I personally get my testosterone is through a pellet. Because I feel like you get a quicker response through a pellet. Now, there's some people who maybe will debate that, but in my clinical practice, most people love their pellets. They love their pellets. And cream takes a lot longer too, because skin can vary on how it absorbs.
Oh, I see.
And a lot of times your skin and how you apply it, it really should be given more than once a day to really have an effect. So if you see, testosterone is going to wear off, anywhere from 12 hours to 24 hours, you're going to get more of this throughout the day. Where if you do it through the pellet form and it's in the fat of your tissue and the blood vessel forms around that pellet, you're going to see more over a period of 3 or 4 months, kind of like this. A lot of people don't like the creams because they don't want to share it with their partner. Maybe you might want to share your testosterone, but then do you really want to pet your dog after you apply it? Or make sure you have to just be careful what you do with the creams, touching the faucet, petting your dog after you put it on, getting in the sheets and rubbing it on the sheets. And then you're sharing it with maybe your children or your partner or whoever. And so it can just be a little bit more complicated and messy. But some people really like the creams because they just don't want to go through the insertion of the pellet. And you can't take the pellet out, but I have never once had anyone ask me that they wish I would take the pellet out. I've always said I wish you'd put more in.
Okay, I like that.
So sometimes it takes a little while to figure out the exact dose, so we might have to put more in, or you might have overshot a little bit of the testosterone, so maybe someone might be having a little bit more acne or some male pattern hair loss that they don't like. And so we just need to adjust the dose next time, and we can put you on some medications or supplements that can kind of lower it a little bit until we get the right dose.
I like that. Do you guys take insurance?
Yes, we do, but bioidentical hormones is not something that is covered by insurance. But like the evaluation prior to the treatment, we can definitely take insurance for that.
Okay. Now I have a big question I hear a lot online. As you know, everybody goes to Dr. Google. So if they have a problem, Google says, oh, okay, I guess my ear's going to fall off next week.
But you know what I like about that though, is I don't like it when we tell the client, you're not allowed to figure it out.
Exactly. I like that.
And so I think going to Dr. Google, collecting the information is fun. But now going and confirming it with somebody who's been in that type of practice or had that type of experience and saying, yeah, I think this seems right. No, this seems wrong. Because let's face it, we all use Google. We all use Google to collect our information.
Correct.
And there's misinformation, correct, but there's also a lot of good information. And so anyway, so I didn't mean to interrupt that.
No, I love the way you put that. That was awesome. The big question that I do have, and I'm seeing a lot of people asking and not sure, is are steroids the same as a testosterone? And how would you explain that?
Is steroids the same as testosterone? I mean, anabolic steroids, there's a correlation, and to be honest, I don't know exactly all the science, chemical structure of it, but considering it is a different type of steroid, and whether or not you would say that bioidentical testosterone, that's a good question to be 100% sure, but like anabolic, is that a steroid? How it busts you up and works as right. That. I think there's some resemblance of such, but I think working like a steroid for anti-inflammatories versus testosterone, they work very differently in how they function, and so to qualify it as a steroid. I wouldn't know for sure, like the anabolics type of steroids and how they use it in bodybuilding and stuff like that. There is definitely a correlation for the bioidentical ones. I don't know. I guess that's something I would have to know if I could use that term correct on that one.
It's an interesting one. This is what people are thinking, like, are they the same or are they totally different? I mean,
I would say they're different. Personally, they're different in the way they function.
Oh,
I
yeah,
mean,
100%.
say there's a steroid. I mean, there's different types of steroids, and so do they have similar functions in the way they work? Possibly, but I wouldn't necessarily call that a steroid. And a steroid is something different, and the way it functions a little bit different in how it functions. But I would definitely have to, so. Yeah.
Good question.
They're good questions, and maybe I need to learn a little bit more on that term, whether or not I can use it as such.
Because doesn't steroids kind of work more with the heart? So I mean, I know that a lot of people that have maybe have problems and issues is taking too much steroids. Of course, I mean, too much of anything is a bad thing. But I've noticed people that, like bodybuilders, take steroids. It's always something with their heart. And I've never heard that with the testosterone.
No, and it's made from a yam. So I mean, it's like those bodybuilding steroids. It actually increases your risk of high blood pressure, cardiovascular disease, and strokes.
Because the steroid is modified. It's really modified.
Yeah, and it's not bioidentical. It's changed, and and so how it works on your body is totally different.
No, exactly.
Yeah,
but steroids, you got buff legs the next day.
Yeah, exactly. And bioidentical testosterone is not going to give you. It's going to help you build more muscle, but it's not going to be your friend who's 60, and just because, it's going to help you build more muscle, but it's not going to help you in a bodybuilding contest to build the muscle to the extent that they were using steroids in that type of competition.
Exactly. I like that.
Yeah. So, I mean, that's the actual term, I guess. But I would not consider bioidentical testosterone to work the same as like a steroid, which has different risk. I mean, steroids actually deplete your bones and causes osteoporosis, and it just causes all the other negative effects that bioidentical testosterone doesn't cause.
Exactly. And then for the last question I have for you, if you were to leave with everybody 3 things that you've seen that helps people, and I'm going to rewind that real quick, not 3 things that helps people, but what are 3 things that you believe that you might possibly need testosterone if you're struggling with. Possibility.
Low libido,
Okay.
poor sleep, low energy.
I can go on and on.
Erectile dysfunction, brain fog. Those are probably the, I did more than 3.
No, that's good. That's good. I should have said 7.
Yeah. But those are the main thing, is just energy, sleeping poorly. Those are the things that, again, but can those be symptoms of other underlying problems? Yes.
Correct. That's why it's important to get blood work done.
Yeah. Yes, correct.
Awesome. Well, Dr. Jody, I just want to say thank you so much. This was fun. I actually had a good time with you, enjoyed a cup of coffee with you. And again, thank you so much for being here. Everyone, if you would like to get more information, call the number on the screen, 701-712-8555. You can also go to our website at livingwelldakota.com, livingwelldakota.com. Everyone, remember, sharing is caring, and it's about getting the word out to helping other people. Please share the video. And everyone, thank you so much. And God bless. And God bless you, Dr. Jody.
Thank you. Thank you for having me. All right. Have a good one. Bye.